under exam 3.
You're talking about the neck?
Cannot remember.
Yeah.
It's exam 2, I think.
Okay.
Did y'all have any other questions about anything else while she's looking, maybe? We do have a list that we'll probably go over in a minute, though.
I was gonna ask about the tympanic membrane, if you guys have any good diagrams on that, and if you could explain how sound travels through like the oval window and then the round window, stuff like that.
Yeah, one second.
Hey Natalia, I found a really good video on YouTube that kind of gives you a rundown on the ear and everything like that in like a very general and simple way. If you want me to send that to you, I can. But that's still a good question. But I know I watched
Yeah,
videos on that stuff. Okay.
yeah, Mariah, that would be great if you could message that to me.
Okay, I will.
Can you send it to me too, Mariah?
Yes, was that Janelle?
Yes.
Okay, great.
Thanks.
I think I'm missing the ear PowerPoint too.
Oh no.
I have a picture. I don't know how helpful it's going to be, but I'll go share it really quick and walk through it.
Okay, here's just a couple of notes that I have written down. It's basically nothing special from what we've talked about earlier, just that it backtracks from where the vagus came from as far as the recurrent laryngeal nerve. And then again, like we've said like 3 times now, that it loops under the subclavian on the right and under the aortic arch on the left, and that it provides innervation to a large amount of the larynx muscles.
All right, can you guys see this picture okay?
Yes.
All right, so when sound travels through this external acoustic meatus right here, it's going to hit this tympanic membrane, and it's going to create like almost like a drumming kind of flexibility there, and that's going to end up moving your 3 bones in your ear here. So it's going to go malleus, then incus, then stapes, MIS, and those bones are just going to hit off of each other, and it's going to hit the base of the stapes, which is known as the oval window right here. And then it's going to move around the fluid within this area. There's a lot of like vestibular stuff going on in here too, but I don't know how much you guys need to go into that. But the sound's going to go down in here into the cochlea, where it's going to move the fluid around here, and then it's going to come back around this way, then out the round window here. Okay, so it goes in the oval window and out the round window. All right, does that make any sense?
Yes, thank you. And then in one of his videos, I don't know if I misunderstood him, it was kind of hard to understand, but he mentioned something about like scaly tympani. I'm not sure what that is.
Let me see. Let me find that. I'm gonna.
I think it's another.
I know I wrote a note on it somewhere here. Where's this layer?
That's the layer that separates the.
I think it's just one of the layers that separate inside the cochlea. Let me just double check that for you.
Yeah, so there's 2 different layers. In fact, Matthew, do you have your ear PowerPoint
Yeah.
accessible? You should be able to see it label. I don't have my ear PowerPoint up
Yeah,
right here.
I have a picture. It's not the best, but I'll share it.
Okay. See, yeah, you can easily see.
There's a good one on the neuro PowerPoint.
Yeah. So basically it's one where you can see, you should be getting into this in neuro
pretty
fairly
soon. Yeah.
soon too. Have you guys gotten into the ear at all? Like the vestibular system with the ear?
Not in neuro yet, no.
Okay. So it's not going to be, yeah, there we go. So the skeleton pani is basically just going to be that like bony area basically. And then the it's kind of like the outside versus the inside is going to be the scala vestibuli. So I guess you could think of it as kind of like if you have like a bag and then what you're putting in the bag, so to speak. Like the scala tympani is kind of the outside layer versus the scala vestibuli is the inside layer. Does that make sense?
Yes, thank you.
Would you guys say that all we need to know for like the ear, like the inner ear and the cochlea, that like there's the scaly vestibuli and the scaly tympani, and then like the basilar membrane and the how it like reads the sound to send it to the brain and like the organ of Corti or whatever. Um, also does has the hairs on it. Is that kind of like a general sense of what I need to know, or am I totally wrong and you guys don't know what I'm saying?
I feel like that's more like neuro. He'll dive into that, or she'll dive into
Okay.
that, I guess. I don't think we really went over into that much detail in anatomy. I
Oh,
could be
okay. So I
wrong, but
just
I don't
need to
think so.
know about like the ossicles and like there's a this like an inner ear, middle ear, outer ear, and stuff like that. More of like the okay, more of the anatomy type of stuff.
Yeah,
Not
Yeah,
okay.
from what
don't
I
remember.
remember, yeah.
Yeah, I don't remember him going into like super detail in the ear because you're gonna get more of that in neuro.
Okay. All right. Thank you.
Hmm.
Any other questions? If not, we can start on the neck list if that's what you guys want to do. Is that okay?
I'm good
Yes.
with that.
All right. All right. All right. So we are going to start. So first thing I have here is I would understand the hyoid bone, its location, and some of the muscles that attach to the hyoid bone, as well as its parts. The parts aren't too bad. It's just a smaller bone. I would know that your laryngeal prominence, that's going to be kind of your Adam's apple here. So that's going to be your laryngeal prominence. Okay. And do you guys know did he talk about neck triangles at all?
He briefly went over it today.
We talked about one that was in the dissector video, but he didn't really like go into depth. He just like was like, oh, this is the triangle.
Yeah, but on the
It
Grand
was basically like
Dissector, it
just
went really in depth with the triangles and stuff. Because I looked over the Grand Dissector already, so they went over like the posterior triangle, the anterior triangle, and all the smaller ones that are in the anterior triangle. Do we just need to know the boundaries? Is it like with like the back where there's like stuff in it, but like things
I would,
like the contents in it and stuff like that, or just
yeah,
the
I would know
borders?
the boundaries, where they are, and the contents. Which we can go over that if that's something you guys want to go over.
Yeah, I understand the boundaries in a way, but I don't know the contents at all.
Okay. I will pull up a slide and we can go over that real
is all your PowerPoints for like the ear and what you're about to show us on the drive that's on?
I believe so, yes.
Okay, great.
Yeah, I saw him on the drive.
You guys see that okay? Yes, no?
Yeah, it's there.
Okay. So your anterior triangle and your posterior triangle, it's mostly going to be separated by that sternocleidomastoid muscle, your SCM. What's important about your SCM is it's the only other muscle innervated by your cranial nerve 11, along with that trapezius back here. Okay. So your sternocleidomastoid separates your two triangles here, the anterior and posterior. And within these triangles are a bunch of smaller triangles. We will get into that. But if we just talk about the anterior triangle versus the posterior triangle, the anterior triangle is going to be, the borders are the midline, the inferior margin of the mandible down here, and the anterior margin of the SCM, like I said, which is right here. Okay? And your posterior triangle is going to be the posterior margin of your SCM, the anterior margin of your trapezius, and then the middle 1/3 of your clavicle, which is right here, down here. Okay? Those are your borders of your bigger anterior and posterior triangles. We go down in here. So these are going to be the smaller triangles within each one. So within your posterior triangle, you only have two different triangles, which is going to be your omoclavicular triangle and your occipital triangle. So your occipital is up here, your omoclavicular is down here. Then your anterior triangle is going to have your submental triangle, submandibular triangle, parotid triangle, and your muscular triangle. Okay. And I wrote a list here. Give me 1 second. I wrote a better list so you didn't have to. I'm going to take that picture away so I can read off the list, but Tanya or Aaron, could you pull up that picture real quick? If you're able to.
1 second.
I don't have dual screens today, so I can't.
Well, good. You got it, Aaron?
Yeah.
Okay.
You on this one, right?
Uh,
Or that one? My bad.
yeah, that one. Okay, so if we look at that picture, we're going to look at your anterior triangle first. So your anterior triangle, you got that submental triangle down here. That one's not as important as far as borders. Your submental area is really just underneath your chin here. So that's going to be your submental. So if we move on to your submandibular triangle, your borders are going to be both your digastrics and your mandible. So we look at this B area right here. You have your two digastrics. I believe that's your anterior and posterior digastrics. Is that right, Aaron and Tanya?
Say that one more time.
I cannot remember.
I think you're
Your
right.
digastrics, you have your
Anterior is like on top.
Yeah. So you have your anterior belly of your digastric, which is there, number 4. That's it's going to be the border of the carotid triangle, and then the posterior belly of the digastric is going to be the
So
what
So
is it, the occipital triangle border, bottom border.
they're both number 5. It's just
Yeah.
the one in
Sorry,
the
I was
front,
looking at number 4, number 5, sorry.
the one in the front, like on the tip of the chin, I guess, is anterior, and then the one to the back, obviously, is posterior.
Sorry, I was looking at omohyoid, not whatchamajigget,
You're good.
the digastric. But like it also has like a little central tendon right there, kind of right below B. That's on the hyoid bone there. It kind of is just, so these aren't two separate like muscles. It's just a tendon. The kind of, I feel like, to me, it looks like a little slingshot, basically. But
Yeah. So that was your submandibular triangle. If we move to your carotid triangle, which is that C area, your borders are going to be your digastrics, which is mostly going to be that posterior belly of your digastric, your SCM at the 1 here, and the superior belly of your omohyoid, which is that 4. That's going to be your superior belly of your omohyoid. Okay. And in the carotid triangle, that's where you're going to find your carotid pulse, and that makes sense. Carotid triangle, carotid pulse, your carotids are going to be in there for you to feel your carotid pulse in. If we move to the muscular triangle, which is this D section down here, you're going to get your omohyoid, your sternocleidomastoid, and your sternohyoid. That sternohyoid is the one to the right of that arrow on the D area right there. That's your sternohyoid. It connects, like it says, from your sternum to your hyoid bone. So a lot of the neck muscles, you can really get their origin and insertion off of their names, which is really nice. So like I said, that sternohyoid is from that hyoid to your sternum. If we move on to the posterior triangle, we got your omoClavicular triangle. And that's going to be the inferior belly of your omohyoid, which is that other 4 down here. Okay, the inferior belly of your omohyoid, your clavicle, your sternocleidomastoid, and what's important in there is inside your omoClavicular triangle, you're going to find the subclavian vein. Okay, and if you look at that, where that generally is, it makes sense that that's where your subclavian vein is going to be, right near your clavicle there. And then if we move on to the last triangle, your occipital triangle, that's your very back. Occipital makes sense. Usually when you refer to your occipitals, it's more toward your back area. So your occipital triangle is going to be your traps, your inferior belly of your omohyoid that separates those 2 posterior triangle sections there, and then your sternocleidomastoid again on that kind of more medial border. Right, I believe that's all I have for the triangles. If Aaron or Tanya have anything to add to that.
Oh.
Don't think so.
So, like I said, the important contacts are going to be in that carotid triangle right there. That
Sorry.
That posterior triangle, the omoClavicular triangle, is going to be your subclavian vein.
And the way this might show up as a question, like we've said before, our professor liked using stab wounds, so he'd be like, a patient like came in because of a stab wound to the neck, like in the let's say the posterior triangle, which of the following would be spared, or which of this following would be affected, something like that.
All right, do we have any questions on any of that?
Quick question. In the occipital triangle, is that nerve that's being shown the spinal accessory?
Yeah, I'm pretty sure. Let me double check. I know there's a picture that just had it. Yeah. It is.
Yeah, your spinal accessory is right there, yeah. So like I said, that's going to only innervate your SCM and your traps is the only innervation for your cranial nerve 11 there. And if it runs through that area, it kind of makes sense. Right? Any other questions? Yes, no, maybe. Right.
Oh, are you gonna go over? I'm sorry. Are you gonna go over the like the artery branches and the vein branches? Do you guys have like any like pictures like the brachial plexus or something like that, or we just need to memorize it?
So, sorry, I mean in a fry. But so what's important about your brachial plexus, especially in the neck area, Your brachial plexus is located in between your anterior and middle scalene. Okay? So you can have a neck injury and you can feel it all the way to your arm. That could just because of the location of your brachial plexus. So that's most definitely probably going to be a question on your exam. It's going to probably be like, this guy suffered a motor vehicle accident or something, and he hurt his neck, and he's experiencing tingling in his first and second digit. Like, why is this the case, or explain why this is happening. And like I said before, that's only because, yeah, so you can see it there. Your brachial plexus is coming off of your anterior scalene muscle, which is that 3, and your middle scalene, which is that 6 right there. You have 3 scalenes, your anterior, middle, and your posterior scalenes. They're also accessory muscles to breathing, as the anterior and middle attached to your first rib, I believe, and your posterior scalene attaches to your second rib. So they have accessories in breathing as well. But like I said, what's really important is to know that brachial plexus lies in between that anterior and middle scalene there.
Yeah, so just to kind of drive the point home, like, know that if you had an impingement in between those two, that could cause you to have like you could have numbness and tingling down your arm because of an impingement in between the anterior and middle scalene.
And that's a concept you guys should nail down, because it's definitely going to come back to haunt you. It's going to show up in clinic. It's going to be something you want to think of when you're seeing even a arm, like any sort of like arm injuries or whatever. You want to assess their neck as well if it's affecting their arm. So
Yeah, I think like also not just the brachial plexus, but be aware of like this entire list that kind of emerges between the anterior and middle scalenes, like the phrenic nerve, which the phrenic nerve does what? As a review. Anyone?
have they gone over phrenic nerve?
I don't know that. Oh yeah, they have.
Yeah.
Have they?
Anyone?
Sorry, my mic wasn't working. Doesn't it innervate your diaphragm?
Yes, good. So again, like think about the issues that you might have if it's impinged too. Like that can cause like breathing problems, right? Because your diaphragm isn't able to like help you to do proper breathing techniques, because it's going to now be it's now not going to be innervating your diaphragm for the motor of diaphragm. And then Aaron, can you go back down again
Yeah.
real quick?
He mentioned something about like a C345, keep the diaphragm.
Yeah, so the phrenic nerve comes off of C4, C345, and that's how I learned it too. 345, keep the diaphragm alive. It comes off of the roots C, 3, 4, and 5, which if you have a picture of the brachial plexus, you can see it a little bit better. Yeah, there we go. You can see that's coming off of 4. It doesn't really show it well there, actually. That's the long thoracic.
Yeah, I don't think there's a good picture of it.
Yeah, it's okay, but you get the point. And then also know, back to the posterior cervical triangle picture. Also know that the subclavian comes in between there too. So not only would you have like neurological issues, you're also gonna have issues from a like vascular point of view too, because now you're not going to be able to get sufficient blood supply to your arm either if you have an impingement of the scalenes. Let's see. I think that's pretty much it. We went over the brachial plexus coming out of there, subclavian, phrenic. I think that's pretty much all I have to say about that. But yeah, just know what comes out of the anterior and middle scalenes, and know what the consequences would be if they were to be impinging, like what they would be impinging.
I'm 100% sure it's gonna be a question. If he doesn't test on that, then I don't know. He definitely should. Because, like I said,
I know he went a lot over the external like carotid branches.
What was that, Kyle?
He harped on a lot on like the branches of like the common carotid and then the X.
Yeah, I would definitely know. Like, I know I was talking to someone earlier this week who I had a personal session with who was asking about like blood flow and basically the kind of things that you want to know when it comes. They were like, basically, well, what should we do when it comes to like arteries? Basically, this like you want to be able to go through and know what like see how they're like labeled here, know what branch comes off when, and that's really just going to come from spending some time with like your anatomy textbook or pictures from the slides to know what branches come off of when, because a lot of your questions that will have to do with blood vessels will be like the proximal branch or whatever of, let's say, the carotid, like its common carotid is occluded, what will be spared, something like that. So kind of know what branches off when, just in general, when it comes to um, your blood vessels, if that
And
makes sense.
if you go to the PowerPoints that we put up, there's pretty good pictures with like the numbers labeled, kind of like this picture. What I did to kind of memorize is I just go through and mark it out on Notability and try to like say I'm gonna name number 9, and then uh, try to figure out what it is, and then erase what I like marked out so that I can kind of like quiz myself like while I'm studying, I guess. That was a good way for me to study.
and I know another way to study. I mean, I know you guys haven't gone to the heart yet, but I know what a few of us did before was we would start at the heart, which is obviously where all your blood vessels start and go to. And from there, you would draw out each blood vessel and all of its branches. I know that's a lot of work, but I know for some people, just drawing it out, especially from starting at the heart, helps really like nail some of that blood vessel stuff down. But I mean, personally, I wouldn't say the blood vessels aren't important, but when I was in class, I know I didn't really study them maybe enough. But I know, I mean, spend time to study them, but obviously don't prioritize them over maybe some of the muscles and more functional stuff. But at the end of the day, yeah, still know them.
And Kyle, to kind of harp on the arteries, is a good picture on our PowerPoints. I feel like it'd be easier for you to look at it like when you can see the picture in front of you, because if I just labeled off these arteries, then it would kind of, I feel like it wouldn't be very beneficial.
Yeah, your guys' PowerPoints I feel like help me so much more.
Yeah.
Yeah, I feel like I said before, kind of to Aaron's point, I feel like this is something that you just kind of have to spend. We could spend the whole like tutoring session just going over arteries, but I think the most beneficial thing is just spend some time looking at the pictures, especially slides like this, to know what comes off of where and when. If that makes sense.
Any more questions, or do you just want us to keep going through the list? All right. Matt, you want to keep going through the list, or?
Yeah. Do you have the slide that has the separating like fascial layers? It should be on there somewhere.
Yeah. The triangle, like these?
No, it's kind of like a cross section. I think it's more up.
Oh, yeah, I know what you're talking about.
Yeah, there you go.
There's a better one with everything.
Yeah. Scroll up a little more. I think there's a list. Yeah, there you go. So this is not necessarily have to like memorize it, but I would understand the concepts in this picture. So your neck is kind of separated by these different fascia, which are these, and they're color coded here for you. You have your superficial fascial layer right here, and the only thing really important inside your superficial fascial layer is you're going to be your platysma muscle. Your platysma is a very, very thin muscle, but it's within that superficial fascial layer and the yellow there. And then if we move on to the green area, that's going to be your investing layer of the deep cervical fascia. You're going to find your some of your maybe larger neck muscles there. So you have them in your front here and then your back. And then if we move on to your orange, which holds your vertebrae, so that's your prevertebral fascial layer. And then your purple, which is your pretracheal layer with your trachea in it. And then one of the big points in here is your carotid sheath, which is this red area. That's where you're going to find your vagus nerve, your common carotid, and your internal jugular vein. I would definitely know the contents within your carotid sheath. I will say it again. That's your vagus nerve, your common carotid, and your internal jugular vein. There's a picture later, but we don't need to show right now. But your common carotid, like I said, is in that carotid sheath. But once it bifurcates into the internal and external carotid, that external carotid is going to leave the carotid sheath to go to your scalp and your face. Okay. So that's an important concept as well, that the internal carotid will stay inside the carotid sheath while the external carotid is going to leave the carotid sheath. Okay. Could you go to the slide with like the danger space? It's maybe a little bit down. So yeah, if you stop at that slide first, the carotid sheath slide, sorry. So here's your contents of your carotid sheath, your common carotid, vagus, and your internal jugular vein. And then you can see right there where your external carotid is going to leave that internal carotid out of the carotid sheath there. Okay. Yeah, you can move on to the space I was talking about.
I was muted.
Okay.
I said, did you? I don't know if you mentioned the ansa cervicalis, but our teacher loved that
Yeah.
nerve, so I would kind of know that, and we'll probably get into it in a minute. I would imagine it's on the list.
Yeah.
I would put it, I would look at a different picture later too to kind of see where it travels, because that picture obviously is only a cross section, but there's better pictures where you can see where it travels.
So if we look at this picture, there's two spaces within those fascial layers. So if you look at that one area where kind of outside of your carotid sheath and that tracheal layer there, that's going to be your retropharyngeal or retrovisceral space. So that's the one. And two is going to be your danger space between that prevertebral and that common carotid area right there. And what's important about that is that's your connection between your neck and your thoracic cavity. So if you have, let's say, an infection in your neck or something like that, it can very well travel down through your and connect to your thoracic cavity through that danger space right there. That's a good clinical question to know. Any questions on any of that? No? Okay. Tanya, do you want to go over the ansa cervicalis?
Yeah, I can. Let me
Right there.
pull up my notes here. Give me a second.
That's the only picture.
I feel like,
I kind of like that one.
really
But
starting with the first picture isn't a bad place to start, but give me a second and let me grab my notes real quick. Just so that I don't miss anything important off the top of my head. It's thinking. Okay, there we go. Okay, so you can't really see it in this picture, but in another picture you can see that the ansa cervicalis is going to run down, like it's going to run with the external jugular. Don't
I'm
think
trying to see it.
you can kind of see a peep through, but there we go. There's the external jugular. So it's going to basically run down the same, yeah.
Gonna go back to that one.
Yeah, it's okay. So yeah, it's going to run down the same path kind of as the external jugular. And if it was damaged, you're going to have difficulty swallowing. And you would also have a hoarse voice. Those are the two things like you definitely want to know. I have them like super highlighted here in my notes as something that would happen if your ansa cervicalis got damaged. So let's see what else I have here. Okay, so it kind of is there can we go to the other picture, Aaron?
Yeah.
Just kidding. Okay, so it's going to have an inferior root and a superior root. So the superior root here is going to come, that's what kind of runs with the external jugular. And then it's going to loop right around, and then you have the inferior root. And that inferior root, what's important to know, the superior root runs with the hypoglossal root. Sorry, I'm trying to see here. Go back to the beginning slide, Aaron. That one. Okay, yeah. So with this, I think it's important to not just look at the ansa cervicalis, but look at like the whole picture. So I feel like that would be a better way to attack this slide. So for C1, that's going to be the nerve root C1 coming off. That's going to be the ventral, considered the ventral ramus, and that runs with the hypoglossal nerve before it descends into the superior root of the ansa cervicalis. So you see here the ansa, I don't have the clicker, I realize, but yeah, so C1 is going to contribute its branch to become the superior root of the ansa cervicalis. You see what I'm talking about? I'm like sitting here. Yeah, there we go. So yeah, there's a branch that comes off of C1 and turns into the superior root of the ansa cervicalis. All right. And before it goes to run into the superior root, it runs with the hypoglossal nerve. And that will see that ventral ramus that comes off of C1 helps innervate the strap muscles in your neck. It also innervates, it gives its roots to innervate the geniohyoid and the thyrohyoid muscle. And then there's the dorsal ramus that comes off of C1, and that becomes the suboccipital nerve and innervates the suboccipital muscles, like at the back of your head. Let's continue. C3 gives rise to the supraclavicular nerve. Comes off of that. You can't see it in this picture. And then C4 also gives rise to the supraclavicular nerve. Okay, now we're at the ansa cervicalis. So the superior root will come off of that ventral ramus of C1 only. And then the inferior, can you go back to the first picture, Aaron? I feel like it's a little easier to see. There we go. Okay, so yeah, so the superior root is only coming from C1. That's important to know. But the inferior root is coming from C2 and C3. And like Matthew said, it's found in the carotid sheath, and it's the motor component of the cervical plexus. So its branches, the branches off the ansa cervicalis, all these little like sticks that are coming off of that loop, those are all going to innervate the infrahyoid muscles. So the muscles that are below your hyoid bone. And let's see. So that's the motor component of it. And let's see. The sensory component come off posterior laterally, posterior to the SCM. Okay, I think that's pretty much all I have for the ANZA. Is just know that the superior root is off of the ventral ramus of C1, the inferior root is off of C2 and C3, that it's in the carotid sheath, that the motor component of it innervates the infrahyoid muscles, and that's pretty much all I have as far as important information of the ansa cervicalis. And then, Erin, can you go down now so you can kind of see where it is? So yeah, when you're looking for the ansa cervicalis in the neck, the way you kind of try to find it is kind of start where the external jugular is and go down, and you should be able to find, or go, sorry, a little bit posterior to the external jugular, and you should be able to find it pretty easily. But I guess you guys don't have like physical labs. But if you have like a picture and you're like, what nerve is this? Know that it's going to be just kind of posterior to it, and then look for that loop. That loop is pretty characteristic of the ansa cervicalis. So anytime you see a nerve that has that big loop, and is coming off of the cervical plexus, you know that's going to be your ansa cervicalis. Any questions?
I know you said the inferior ansa I can't talk.
It's okay. Cervicalis.
Yeah, thank you. Runs in the carotid sheath, you said?
Mm-hmm.
So
yes.
When they say the vagus nerve runs in the carotid sheath, it's really the inferior ansa cervicalis.
Erin, can you go back to the picture that has the carotid sheath?
So it is both. Let me see. Find a better picture. There's this one. See how the vagus is kind of at the bottom.
Okay. So I was just thinking that that's a good picture. That the ansa cervicalis was like a branch of the vagus, but that's totally wrong.
Yeah, so it's not. Remember again, like we just talked about too, that the ansa is coming straight off of the cervical plexus. So it's coming off of C1 for the superior portion of it, and then the inferior is coming off of C2 and C3. Any other questions? Thanks for controlling the slides, Erin. I appreciate it. Anything else, guys?
I think we have like a few more things on the list.
Yeah, we can go over the neck muscles really quick with the remainder of our time, I guess. So we're gonna start with your infrahyoid muscles. Infra meaning under, hyoid, it's your hyoid bone. So infrahyoid is connected underneath your hyoid. Those are your muscles there. They're also called your strap muscles. I know Tanya said strap muscles before, but so your infrahyoid muscles are going to be your strap muscles. Um, they're responsible for swallowing and vocalization, which is your talking. And they are innervated by your ansa cervicalis, like we said. So infrahyoids are by your ansa cervicalis. But
Not a great picture.
yeah, I mean, if I'm just gonna list them down here, so your infrahyoid muscles are gonna be your thyrohyoid, your sternohyoid, your omohyoid, and your sternothyroid. There's something special about your thyrohyoid.
And I guess kind of just to think about where these muscles go, like really just break down their names and they will tell you like where their insertion and origin are.
And so your infrahyoid muscles, like I said, are all innervated by your ansa cervicalis, besides one. Your thyrohyoid is innervated by your hypoglossal nerve, not your ansa cervicalis. So your thyrohyoid is by your hypoglossal. And if we go to your suprahyoid muscles, which is above your hyoid, and if it's above your hyoid, it's going to elevate your hyoid when it contracts. So that's going to be your mylohyoid, your geniohyoid, your stylohyoid, and your digastrix. And like Tanya said, to get the origin and insertion, you really just kind of look at the word and figure it out. I did mention before about the mylohyoid and the geniohyoid, their location right underneath the genioglossus when you separate the face in half like this. So if I'm going to repeat that again, you get your genioglossus, which is your large tongue muscle. Then right underneath that, you're going to find your geniohyoid, and then right underneath that, you're going to get your mylohyoid. But those are primarily suprahyoid muscles of your neck, which are going to elevate your hyoid up. Okay. We mentioned before your anterior, middle, and posterior scalenes. So like I said, but in between your anterior and middle scalenes, you're going to find your brachial plexus and that subclavian artery. And so your anterior and middle, I said this before, attached to your first rib, and they're going to elevate the first rib, and your posterior attaches to your second rib, so it's going to elevate your second rib. And there's a condition called torticollis. I don't know if he talked about it, but what happens is when you're born, or for whatever reason, you're going to have a shortened sternocleidomastoid muscle. So it's short. Let's say I have this side torticollis, right? So this is going to be shortened. So my head's going to be tilted this way, and I'm going to be rotated. My head's going to be rotated away from the affected side. So that's kind of like a side bending to my right, and then rotation away. Okay, so ipsilateral side bend, contralateral rotation of your neck. And like I said, that's due to a shortened sternocleidomastoid muscle. Okay. And that's about it for that list. Any questions about the muscles? Yes, no. Any questions on anything else?
Nope, that's pretty much it for me. I was just making sure that what I got about the arteries the other day was all I really need to know. But yeah, I haven't watched his lecture, so. Oh, never mind. He hasn't posted it yet.
Then you're talking about the neck, or?
Yeah. He said he'll post it over the weekend, so we can watch it over the weekend before the test on Tuesday.
Oh.
Yeah. But
I'll be looking at your guys' PowerPoints.
Yeah, I would. I mean, I hope we were at least decently comprehensive in the neck today.
yes, it definitely went along with like the grant dissector book stuff that we went over, well, that it went over, but I have no idea what he's going to say on this lecture because it's still all pictures. So,
I mean, yeah, obviously focus on those muscles. I mean, for your PT guys, I'm pretty sure everyone here is a PT, but that's going to be something you guys will continue to carry on, especially that SCM muscle. Um, let's see what else. Yeah, I mean, and then for anatomy, those neck triangles I would say are important, and kind of your attachments and anatomical parts of your hyoid bone. Yeah, carotid sheath and those fascial layers. I think we pretty much went over some of the bigger concepts in the neck today. Who knows? I don't know what he puts on his slides, so.
so yes, you guys been very helpful. Thank you so much.
Yeah, no problem.
Yeah, thank you.
Thank
We
you.
appreciate you guys.
Awesome. Well, if you guys don't have any more questions, we'll be here for a little bit, but yeah, you guys are free to go, I guess. See you guys. Alrighty.